for gastrocs, I start just below the popliteal space. You see medial gastroc. Do you do these anyway already? Yeah.
No.
Okay.
Not big.
Okay.
Just we check for Becker cyst,
Okay.
activity, effusion.
Do you have? Can you make it like a widescreen or no? We can do the curve probe too.
Yeah. No, the curve probe. Widescreen.
Just so I can show you the whole muscle.
Yeah.
So anyway, this is your medial gastroc. Yeah. So medial gastroc, you can see here. This whole area. Tendon tear. A lot of people have pain in the area of their tear, proximal or distal. You know, they'll start having pain when you're scanning. You'll see a hypoechoic cleft inside there. Grade 1 tear, the muscle just looks heterogeneous. You can't actually find a fluid collection or anything. Grade 2, it'll be like intramuscular. Grade 3, it's normally torn off proximally up here. You'll get retraction. I mean, normally people have proximal medial gastroc tear more than distal. But you'll see the muscle like bound back, almost like when you saw with like the pec, and you can like see that it's retracted, and that's a grade 3.
Grade 4 is 1 in 10.
We don't have grade 4. We just do 1, 2, 3. Grade 3 is surgical intervention for us. I don't know specifically, and then you just follow it all the way down to insertion. You can see it there. Plantar tendon is right in here. Not great with ultrasound. Just honestly, it's not. Yeah.
And on cadaver, it's very tiny.
Very tiny, yes, exactly. And a lot of people don't have it. So it's kind of hard to tell on some patients, yeah, whether they have it or not. And then we just do the same thing. You can just come lateral out here, lateral to see. Here you can see this is medial gastroc, lateral gastroc, soleus. They call Mercedes-Benz sign. It's like here, here, and here. And then you do the exact same thing. You just scan down short or transverse and long axis to the insertion. And just make sure, you know, there's nothing in it, no fluid. So if I think someone has a grade 1 tear, I'll compare it to the other and see, and you'll see the muscles very heterogeneous in the belly. Soleus is, as you can see, it is not super amazing with ultrasound. If they have a big tear, you're going to get that same complex hematoma, things like that. So you'll see that. Achilles. Can you scoot down to where your foot's hanging off the bed? I'm sorry. Toe towards the floor. I don't think I can see that from here. Can I bring this back? I don't think I can see. Okay, so here you can see where the Achilles is starting. You just slide down. Yep. So it is, we increase our depth a little bit. There's Achilles at the top. Yeah, exactly. It should be, again, the same thickness all the way down to the insertion. So this is, I do need a little bit of gel here, calcaneus. So you can see here the insertion on calcaneus and see how she has that. This would be like calcific. So this is calcium at the insertion on calcaneus. A lot of people have it. She probably doesn't have symptoms now. See it there, how this should just be smooth across here, but she has this shadowing here. That's a calcium deposit.
That's within the tendon.
Within the tendon, right at the insertion, yeah.
It's not exostosis there.
No. This area is Kager's fat pad right here, where it's kind of hypoechoic. So if they were having a lot of pain, but the Achilles looked normal. You can drop color down in this area here, and it'll light up, not like this, but it'll really light up. It'll look inflamed. And then Achilles, same thing. You just short axis. This is Achilles right here. Sweep down all the way to as much as you can. I'm trying not to use a lot of gel to calcaneus. See, now you can really see the calcium.
Yeah.
So that is the normal calcaneus bony contour. Sweep down, you can see the calcium deposits. Plantar fascia, you come here. I know this is a lot, but while she's like this, I figured. It's this tiny area right here. So it should be 4 millimeters or less. I don't know if you get a lot of people with plantar fasciitis or whatever, but we do. So hers is 2 millimeters. It's very small. It'll get really big. Yeah. And that's most of like leg, Achilles, foot,